Okay, yeah, go ahead and leave it.
Hello.
Okay, raise your hand if you've ever heard about the ketogenic diet, and look around the room. Keep your hand raised if you feel confident in your understanding of the ketogenic diet and how it works inside your body, and look around the room again. Most of us know what the ketogenic diet is or have heard of it, but don't actually understand how it works or what it does inside your body. So today I'm going to talk about what the ketogenic diet is and what it does inside your body. After listening, you'll be able to make a more educated decision on whether the ketogenic diet is the right one for you. I'm a soon-to-be registered dietitian nutritionist. I've had a lot of practice explaining the basics of nutrition to people, and I've also done a lot of research on the ketogenic diet to make sure I give you all the most accurate education today. So today we're going to talk about the basics of the diet, normal versus ketogenic, and also we're going to talk about the metabolism of these two diets, and lastly we're going to talk about the short-term and the long-term effects of these diets. So to begin with, the basic components of a diet, you have three categories. They're called macronutrients, and they're your carbs, your proteins, and your fats. So carbs are made of things like grains, fruits, vegetables, dairy, and sugar. And proteins are made of things like meats, dairy, beans, nuts, legumes, and fat is made of things like meat, dairy, olives, avocados, nuts, and the RDA, which stands for the Recommended Daily Allowance, says that you should be having approximately 45 to 65% of your calories coming from carbohydrates, approximately 10 to 35% of your calories coming from proteins, and approximately 25 to 35% of your calories coming from fats. That's the normal gold standard for the average healthy adult that is put forth by the Food and Nutrition Board in the Institute of Medicine. So the ketogenic diet, there really isn't an RDA. It's not typically recommended for the general population, but the range of macronutrients for that is 5 to 10% carbohydrates, 15 to 35% proteins, and 60 to 75% fats. So as you can see, there's a huge difference in the range of carbohydrates to, or sorry, not carbohydrates, but macronutrients from normal diet to keto diet. So now that we've talked about the macronutrients and the differences between normal and keto, let's talk about the metabolism of them. So carbs are usually your body's first source of energy in normal conditions. It's the most immediate and most efficient, so your body's going to use them first. But under ketogenic conditions, what happens is, because you're depleted, your body's going to save them specifically for your brain, your red blood cells, and your spinal cord, because those three things cannot get energy from anything else besides carbohydrates. Now, for the proteins, under normal conditions, they are typically used not for energy, but for metabolic functions such as the structure of muscles and organs, or chemical reactions like the machine that does them, or also directly interacting with your DNA. Fats are typically used under normal conditions for storage or for in your cell's membranes, or lastly in chemical signaling. So under ketogenic conditions, those two things, instead of using more for metabolic functions, they're used more for energy. And that's not ideal for proteins, because for protein to be used as energy, it has to be stripped of the only thing that makes it special and just excreted. And that's kind of funny to me, because you're actually that's the most expensive part of the protein, so you're literally just dumping your money in the toilet. And then as for the fats, it's just slower, so it's not ideal. It can leave you feeling rather fatigued sometimes. So that's the macronutrient breakdown inside of your body of these things. One of my professors from the University of Florida once said that fat burns in the flame of carbohydrates. And what that means is that fats are not going to be able to be used as energy unless there is a presence of carbohydrates. So in the cases where you don't have carbohydrates, like the ketogenic diet, your body's going to turn those fatty acids into what's called ketones. And those ketones serve as your body's emergency source of energy for your brain, your red blood cells, and your spinal cord. It's an emergency source. This is not an ideal situation, and it only happens when you don't have enough carbohydrates. So now that we've talked about what happens inside of your body during the ketogenic diet, let's talk about the short-term versus the long-term effects. So there's both positive and negative effects for the ketogenic diet. There's a lot of research done on the short term. One of the positive short-term effects is that you will lose weight if you have excess weight to lose, but maintain your lean body mass, which is the ideal situation. Your lean body mass is muscle, by the way. Some of the negative effects of the ketogenic diet is that you may get stinky breath, you may get nausea, you may get abdominal pain, or even memory loss or confusion. And those things happen because you have a buildup of ketone bodies inside of your blood. Now, the long-term effects are not studied too much yet. They're in the process of being studied, but it hasn't been that long since this diet has been a huge fad. So what we do know about this diet is that you're increasing your fat intake. And with the increased fat intake, you are likely increasing your saturated fat intake, which is linked with a higher risk of heart disease. So potentially the long-term effect of the ketogenic diet is increasing your risk of heart disease. Now, there are research articles posted by the Lancet of Neurology and the International Journal of Cancer that says that certain patients may benefit greatly from the ketogenic diet if they're dealing with certain cases of cancer or epilepsy. So I think that's pretty amazing that the ketogenic diet can help in some clinical situations. So to conclude, what we've talked about so far is the macronutrient breakdown, how the ketogenic diet has 30% less carbohydrates than the normal diet. It has 5% more proteins and 35% more fats. We've talked about how they're metabolized and that the fatty acids are used as your emergency source of energy when they get converted to ketones in the lack of carbohydrates. And also we've talked about some positive and negative short-term effects. So thank you all so much for listening. Does anybody have any questions?
Some question. Do you recommend the diet for bodybuilders?
Do I recommend the ketogenic diet for bodybuilders?
Yeah.
That is a good question. So when it comes to choosing diets for people, it does go by a case-by-case basis. The ketogenic diet may work for bodybuilders in the case that it will decrease their fat mass, but it might not be ideal for increasing muscle mass. So if they're just trying to lean down, it might be good, but maybe not for increasing. I can answer your question more thoroughly after doing some more research on that topic.
So you talked about how if you're doing the ketogenic, one of the side effects could possibly be bad breath.
Yeah.
How can you combat that?
How can you combat the bad breath?
Besides the mouthwash.
Besides brushing your teeth and stuff. So that's something called keto breath. It's a real thing, and it usually smells like rotting fruit, if you will, kind of like a sweet, foul smell. And the best way to combat those negative side effects is to make sure you're getting enough carbohydrates. So make sure you're at a minimum of 10%. Don't go less than that because you're going to experience more of those bad side effects. And they may actually get even worse than what I said. It could lead to even ketoacidosis, which can cause death even. That's extreme case though, just so you know. Okay. Okay, any other questions?
Is it possible to be on the keto diet as a vegan?
Is it possible to be on a keto diet as a vegan? Yes, it is possible to be on a keto diet as a vegan. Great.
Cool.
Okay. Thank you.